Hey everybody, it's Dr. Schulte, your friendly neighborhood drop-in doc, and I recorded a video the other day to discuss some features of our practice, especially a telemedicine component that's allowed us to maintain communications with our patients during this downtime with social distancing and the containment efforts in order to reduce the effect and transmission of the coronavirus. Didn't really go as planned, so there was another opportunity today that happened to be a referral from an existing patient, and we actually had we had the opportunity to help this person out pretty substantially. In short, they live in the Inland Empire, and they were concerned that they'd had upper respiratory symptoms for the past about 2 weeks. They were the sole caregiver for an elderly person, their mother, who obviously the very young, the very old, the very sick. These are the most at risk within our population for adverse complications related to the virus. And so she had tried calling the local health department. She went to her primary care doc. The primary care doc said, just go to any testing facility. She goes to the testing facility. They said, no, you need an order from your doctor. She calls the doctor's office again, and they said they wouldn't give her the order. So out of desperation, she calls us. Had never come to our office before. It was literally just this other patient said, call my doctor, maybe he can help you out. And took about 30 to 45 minutes to talk about her symptoms, to get her information, her health information. Sent her the script, sent her a couple other pieces of paperwork just in case there was any pushback from the testing facility, found some other local testing facilities in case her nearby testing facilities couldn't accommodate her. And all in all, what it amounted to is that we were able to give her the one-on-one care that she was looking for, that you just can't get from the current system's doctor's offices because they're so overwhelmed right now. And a couple elements that come into play is the fact that we opened up in January, so we're still relatively new, and we have the availability and the time, but overall direct primary care practices such as ours, which there are a handful located throughout Orange County and Southern California, it gives us the opportunity to have these exchanges, these interactions with our patients on a daily basis. Currently right now, all of our DPC practices for the most part have converted over to telemedicine, which is basically the FaceTime chats or the face chats, the video conferencing chats that we can have. So if somebody doesn't want to leave their home, if they don't want to increase their transmission or exposure risk, or they worry about having symptoms they don't want to give to somebody else, we can do this sort of exchange one-on-one with them at home and speak with them directly, where you get to talk to your doctor. I know it's a crazy concept, but I speak with my patients one-on-one all the time. I text periodically with them throughout the day, during a normal business day, after hours, weekends, you name it. And especially in situations such as this, where it's so important to have direct access to your doctor, really this is kind of becoming more of an expose on how beleaguered the healthcare system was going into this pandemic, and possibly how we might be able to fix it. So, I mean, we're all a little bit biased here in the direct primary care world, myself included, but it's a great example, great test case to show you this is a very common sense way that we can fix healthcare. So if any of you are interested, this was not intended to be a solicitation video. This is a great opportunity that if you can't get in to see your family doctor, if you've been experiencing these same issues yourself, we are not currently doing the testing ourselves, but we are facilitating our patients' ability to seek out testing and providing them with the orders necessary to have it done at one of the drive-through clinics located around Orange County. But if you need to contact your doctor, if you want to have a month-long membership, just think of it as a trial where you get a chance to get your feet wet and see if this is really the kind of relationship you want to have with a healthcare provider, then we are doing a 1 month, no commitment necessary free trial. It'd be the same thing as if you were signing up with a membership with us. $75 a month for an adult, $20 per kid, a family of 4 with 2 kids under the age of 18 associated with those first 2 adults, $150 a month. Unlimited care, everything that you normally get at your normal doctor's office, and then some. So we do things like IV fluid therapy, we do regenerative medicine, like non-operative ortho stuff for musculoskeletal issues. I do point of care ultrasound for a number of screening and diagnostic purposes. And we also do some sports medicine stuff. We have a body composition analyzer, so if you want to know what your body fat, and your muscle composition is, that's part of our normal healthcare package anyways. More than I could include in this video. I'd much rather talk with you guys one-on-one. That's where I tend to have the most productive conversations. So especially in this instance right now where you need access to a healthcare provider, This is where I would exhort you. Please utilize me as a resource. I have the time, I have the availability right now. I'm looking to build a patient base. I want to be your family doctor. I want to be the person that looks after you and that you have the peace of mind knowing that you can contact any moment with any concerns. So if you'd like to, please feel free to give us a call at our office number at 714-577-2652. We are in the city of Yorba Linda off the intersection of Prospect Avenue and Imperial Highway over by I think it's an LA Fitness or 24 Hour Fitness. But at any rate, we are open. We are primarily doing telemedicine consults for any urgent issue, like if you fall, hurt your wrist, worried that you might have a broken bone, if you cut your finger while you're cooking dinner at night, don't know if you need stitches or not. This is a great opportunity to try out direct primary care and see how much of an improvement it is over the current standard of care. Would love to introduce you to it. Again, it is a 1-month, no commitment, non-contract trial. If you don't want to continue it after the 1 month, that's perfectly fine, but it gives you access to a physician, to a doctor, not some random voice on a telephone that's going to tell you to go to the ER anyways. They don't want to see you. They're slammed unless they absolutely have to. But for all other major medical problems that you need immediate access to a physician to, that's what I'm here for. That's what the drop-in doc is here for. Give us a call. We're happy to help, and we're happy to guide you through this current pandemic until things start to settle. So we hope you're doing well. Stay calm, deep breaths. Feel free to call us for any reason, and we're happy to help you out. This is Dr. Schulte. This is the drop-in doc. We'll talk to you soon.